Hi, welcome to another episode of Small Doses with Laura Sell. I promised on several of the last episodes that I would tie up some loose ends. So today I'm sitting out on this nice deck, the weather's nice, and I think it's time to tie up those loose ends. You remember when I told you I had the fibroid tumors and that they did not end up doing the surgery? I didn't tell you why they didn't do the surgery. They were unable to do the hysterectomy because my blood sugar was too high. Yes, they had just found the diabetes and my blood sugar was too high. So inadvertently, diabetes saved my uterus. Not that I want to be thanking diabetes for anything, but it did save my uterus. So there's a problem with when you have diabetes and you have other conditions. Having high blood sugar prevents you from getting some care you may need in another area. Now, it worked out fine for me that I didn't have the hysterectomy because they were able to later do the endometrial ablation. So, yeah, so that's one thing about diabetes. Another thing about diabetes I didn't tell you about that happened to me. When I was released from the hospital, I was home recuperating. I woke up one morning, I went to the restroom. When you're familiar with your home and your surroundings, you just go and you do things without really paying attention. So I went to the restroom, and it was when I stopped to wash my hands and I looked in the mirror, I could not see my face. All I saw was the outline shape of myself in the mirror, and it was just a blur. So I grabbed for my towel and I washed my face and around my eyes, and I opened my eyes again, and I still couldn't see myself. I just saw a blob in the mirror. So then I stopped and I looked at my hands, and I put my hands in front of my face, and I could not make out my fingers. Everything was blobs. I was, for in all intents and purposes, blind. I could not see clearly. It was just blurs. I don't even think it was colors. It was just like a horror movie when they blur the camera to give you that effect. So I freaked out. I went and I got back on my bed, and I remember crying and being very emotional, and I continued to try to see things, my hands and other things that were in my room, and I just couldn't see them. I don't know how I made out being able to dial my telephone, but I did, and I called my doctor's office. And they put the nurse on the phone because I know I sounded like a hysterical person. I was hysterical. Let's just be honest. If you have been sighted for 40 years and you wake up one day without sight, you are going to be hysterical. So the nurse comes on the phone, and she explains to me, "Oh, Miss Johnson, that's normal." And I'm like, "No, there's nothing normal about me not being able to see." And so she explained to me what happened was that during the period of time that my blood sugar raised, was ticking up. Remember, I told you when I was hospitalized, my blood sugar was at 677. That's a number I will never forget. So she explained to me as my blood sugar ticked up over whatever period of time it took for my blood sugar to reach that level, all of my other body functions were normalizing to the high blood sugar. My body was accepting that this is what we're going to be. We're going to have 677, blood sugar reading. And so all of my organs adjusted and they ticked up to that level. So she said once they gave you the insulin and got your blood sugars down, that was a rapid decrease. It may have taken months for my blood sugar to go up that high, but they got it back down in a matter of days. So because they brought my blood sugar back down in such a rapid way, my other body functions, including my sight, didn't come down as rapidly. It was going to take some time for the rest of my body to adjust that my blood sugar was back normal. And so she told me to be patient. It would take me a few days. And if, within 3 or 4 days, I did not have my sight back to come in so they could check some things. So these are the kind of stories that people don't tell you that happen to them, again, with chronic illnesses, because for whatever reason there's shame and stigmatism attached to them. So, but she assured me that it was normal. And within, 3 or 4 days, my vision did come back. Praise the Lord for that. But it was very scary when it happened. So, I hope none of you have to experience this. But if you do, just know that it does happen. Um, there's some other things about diabetes that, we don't talk about. Diabetes is a tricky fellow, very tricky fellow. So we always associate the foods that we eat with elevating blood sugar. Well, blood sugars, in my experience, and remember, I'm not a doctor and I don't play one on TV. I'm sharing the experiences of Laura Sell because that's all I can do. I had what I thought was a sty on my eye, and it turned out not to be a sty. It was something called a chalazion or something of that nature. I can't remember if I'm pronouncing it correctly or not, but it was like this really huge blister on my eye, and it was infected. That infection on my eye caused my blood sugar to spike. Isn't that crazy? Yeah, that's what happened. The sty on the thing that I thought was a sty on my eye was highly infected, and it caused my blood sugar to spike. But if you remember, during the early stages of the pandemic, they continued to talk about the urgency of taking care of people with comorbidities like diabetes, and they wanted people with diabetes and other comorbidities to get their vaccinations early. And that's because other infections can cause your blood sugars, your diabetes to become really bad. So, but what happened with this infection, once it caused my blood sugar to spike, and I hadn't changed any way that I was eating, I hadn't changed my medication. Well, the way that I knew that my blood sugar had spiked, because at this point I got too comfortable with my life and I was not checking my blood sugars as I should. I smelled that sweet almondy smell that's in the urine when your blood sugar's high. And that's another way you could tell if you have diabetes, is you smell, your urine smells really sweet. And so I had learned over the years that when I smell that smell, to check my blood sugar. So I did, and I want to say my blood sugar was like 200. I almost passed out, because anything over 110, my friends will tell you, I go nuts if my blood sugar goes over 100. So I was like, I think it was 238. I think for some reason that number is sticking in my mind. And so my blood sugar got really high. And so I went to the doctor, and they asked, was anything different? I told them I had this infection on my eye, and they were like, oh, okay, well, that could probably be it. Why didn't y'all tell me this stuff when I was first diagnosed? This stuff like this could make my blood sugar go up. It's the stuff they don't tell you. So anyway, the infection got so bad and my sugar got so high that, of course, as you know, the sugar is spilling off into my urine because I can smell it. Well, the other thing they don't tell you about diabetes is that because the sugar is spilling out of my urine, it caused a yeast infection. So fellas, don't trip and tune out, because guess what? Men get them too, especially men who have diabetes. Men who have diabetes can get yeast infections as well, because the sugar that's spilling out in your urine can affect you as well. And for men, they typically think they have jock itch. And so, yeah, so diabetes affects so many things that people don't talk about. Well, let me share this with you. I don't know about men because I'm not one, but I know about women. If you are diabetic and you do get a yeast infection, the over-the-counter topical treatments are not going to help you, and they're going to make it worse. Make sure that you go see your doctor and that they give you the oral medication. Usually it's like one pill and it works like within a few hours. So make sure that you know about that. Fellas, I'm sure you could probably take the same medication, and I don't know what kind of topical stuff you guys would use, but just note that yeast infection is very common with people who have diabetes, especially if your blood sugars are high. And yeast infection with diabetes is almost like a 5-alarm fire. It's worse than anything that can be described. So yeah, I'm being graphic, but I'm being real, because these are the things, like I said, that people don't tell you. A lot of times doctors can't tell you because they haven't experienced it. They've studied it and they know patients who have it, but they haven't lived it. Some doctors have. I'm sure there's some diabetic doctors out there. But a lot of times people just don't share their personal experiences like that. So, um, if you experience these things, the loss of the sight, the infections causing other problems, especially the yeast infection, check in with your doctors. But most importantly, do everything you can to keep your blood sugars low and avoid situations that will cause you to be exposed to infections. I'm going to tell you, I was in a grocery store some years ago. I was wearing masks before COVID hit. Flu season, I would wear masks because I didn't like taking the flu shot. And I remember I was in a grocery store one day, and let's just say I was on aisle 7. And I heard somebody over on aisle 8 or 9 coughing like they had the bubonic plague. Honey, I left that cart right there on aisle 7 and I got up out of that store because I didn't have on a mask. And I was like, oh no, I'm not catching this thing because I didn't want to have to take the flu shot. So, but we see on a serious note, we really have to be careful about being exposed. So if you're out here in this post-COVID, and it's not really post-COVID because people are still getting it, but if you're still wearing your mask, it's probably a good thing if you have diabetes or other comorbidities, because infections of any kind don't do us any good. And especially if you aren't taking good care to monitor your blood sugars and keep them at a safe and level, you know, in a good place. What else did I want to tell you about the diabetes? It's so many things about the diabetes. I shared with you about the woman who was facing an amputation. Oh, I know what it was. It wasn't about her. It was about the eyes again. So on my last eye appointment, oh, and if you have diabetes, you need to get those eyes checked every year. And unfortunately, sometimes people who are diagnosed just at the doctor's office with a simple, you have diabetes, you don't get these memos necessarily. And I know this because I know people who've been diagnosed at the doctor's office. But anyway, you go get your eyes checked every year, please, because diabetes is a silent killer. It can kill any and all of your organs. And you won't even know it's happening. But on my last visit to get my eyes examined, when I'm not sure what you call their assistants, but the assistant to the optometrist, the ophthalmologist, because I don't see an optometrist, I see an ophthalmologist. When they came in, they looked kind of beat down, like they were not in such a good mood. And I was like, I didn't ask, but I was. Then all of a sudden, they're looking at the X-rays that were done on my eyes, or whatever images were taken of my eyes. And the doctor's attitude got so much better, and he looked and says, "You have diabetes?" I said, "Yes." I said, "I'm 20 plus years, I think." And he says, "Really?" He says, "Your blood sugars are must be controlled amazingly." I said, "I think they are. I work very hard to keep my blood sugar controlled." And I said, "Well, why did you say it that way?" And apparently earlier that day, they had several patients who were diabetic whose x-rays or images of their eyes looked nothing like mine. And he showed me a very damaged eye, the image of a very damaged eye. And then he showed me the image of my eye. My eye looked like someone who does not have diabetes. That made me very, very happy. So take care to make sure that your blood sugars are in range. Don't necessarily be so comfortable with the fact that you're taking medication. Even though you're taking the medication, you still need to eat healthily. You still need to exercise. You still need to drink the water. You still have to do all of the steps, even if you are medicated, because diabetes is still in your body. It's not cured. It's being managed. That's two different things. And so that was one of the things that always concerned me, was that, and then the doctors will say, it must be managed very well. And my diabetes has been managed very well. So be careful to take care of all of your organs. Um, if your blood sugars are hitting above 100 on a regular, please keep your shoes on your feet. You don't want to risk an injury to your foot that may possibly not heal. Um, I had an injury to my leg a couple of years ago, and they ended up sending me to the wound care clinic. It's a place where they send people who have diabetes when they have wounds. Uh, I think I went to that clinic maybe 3 times, and and when you leave, you get to ring the bell. I was like, oh, never heard of this before. How cool! But they were all amazed that I was diabetic and that I had this ugly wound on my leg, and that in 3 weeks I was leaving. My wound had healed. Uh, Looks like I never had the wound there, just a slight scar. But they were just so happy and excited because it usually takes people with diabetes, especially if your diabetes is not controlled, a very long time to heal. So I say this um, because I care. I'm sharing about myself and my personal journey because I care. Every time I run across someone, especially if it's someone I care about who has a diagnosis of diabetes or prediabetes, and I want desperately to keep people that I love from having this diagnosis. So we're going to close now. This has been another episode of Small Doses with Laura Sell. Take care of yourself. Take care of the people that you love. Monitor what you eat. Remember, keep those numbers as low as possible. And I'll be back and we'll talk more about my personal health journey um, with all of my diagnosis and the things that I've learned along the way. And if I can help somebody avoid the pitfalls that I have fallen into, then my job is done. Y'all have a great day. Like, subscribe, and share. And remember, join us again for another episode of Small Doses with Laura Sell. Thanks. Bye.